Thank you for the opportunity to speak, and thank you for continuing to stand on our side, on the side of truth and dignity. And I have to warn you, if I suddenly disappear, it's not my emotion, it's a blackout. And today I share my point of view on how Ukraine sustains cancer care during the full-scale war. And as Nella Melnichuk already mentioned, cancer does not stop because of war, so neither can we. Um, you know that our 200 health workers have been killed, and more than 300 medical facilities have been completely destroyed, including some, of course, oncology departments. And Russians did it. The losses among military medics are classified, but we understand that the actual number is significantly higher. And yet, care and treatment continues. You know, other challenges we have encountered, already described partially by Daria Kizub, it's workforce losses, burnouts. In terms of losses, I mean not only killed medical staff, but also internal migration of health workers from eastern and southern regions of Ukraine to central and western regions. And of course, brain drain. Doctors moved from Ukraine to European countries and some even to the United States. And more than 4 million people were internally displaced. Under such conditions, the continuity of medical care was disrupted, and medical records and documentation were lost. And you understand how important is continuity of treatment for patients with cancer. Due to this displacement, some hospitals became overwhelmed, and at the same time, others remained almost empty. At the beginning of the war, the logistics of medicines came to a halt. No planes were flying, and distributors were unwilling to cross the Ukrainian border. But within a month or two, this was quickly resolved. And of course, financial constraints intensified. Even before the war, the healthcare budget was not very large in Ukraine, and during the war, it became even more difficult to allocate at least 5% of GDP towards healthcare. You know, prioritizing reforms during wartime is also very challenging because we must balance the needs of treating the wounded people with the expanding needs of people with cancer. I just want briefly to show you what the current situation, but Daria already mentioned that you can see that we have 110,000 newly diagnosed cancer cases per year and approximately 50,000 deaths annually, 700 children diagnosed with cancer each year. And, you know, cancer is still the second leading cause of death in Ukraine, and it's climbing. And like in other European countries, you know, lung, colorectal, gastric, and breast and pancreatic cancer account for the highest burden on patients. You know, delaying care is not an option. You can see that. Let me give you a bit of context about our healthcare system because I believe it's a key to resilience during the war. Ukraine continued its universal health coverage reform during the war. It was launched in 2020, and we operate a single-payer system through the National Health Service of Ukraine, financed from the public budget, ensuring that healthcare is funded collectively through taxes, accesses, and duties. The model protects people regardless of displacement or income, and this program wasn't paused even for a day. It is stress tested every day and still stands. The government did not reduce healthcare funding. You can see even the government even increased healthcare fundings, but devaluation reduced its real value because you know currency devaluation. You can see that for this year the budget for healthcare is like 4.1 billion US dollars. How, like, what should be war priorities by my experience, of course. I mean, what should be strategy? Because I mean, I can't honestly distinguish some separate strategy for cancer care, but there are certain things that should be done for all healthcare facilities throughout Ukraine. Like, you should make healthcare facility in daily activities as autonomous as possible. Build shelters, backup power, water, and heating supply. And believe me, I know what challenges will emerge because, for example, today we were figuring out how to refill the fuel tanks of our generators at the National Cancer Institute. These generators consume a lot of fuel, and constantly carrying jerry cans or barrels to them is very difficult. So we were figuring out how to bring some small car to fuel generators tanks using that car. And the second main point, in my opinion, is of course protect health workers, because they are as critical as ammunition during the wartime. We can't leave clinicians alone with their current problems. And human resources departments should be established in healthcare facilities, and relevant professionals must be hired, of course, if you want to retain your team. And in the second photo, you can see our workers during art therapy activities, because I mean, we try to keep our personnel satisfied. We don't want them to feel burnt out and to leave our healthcare facility or even leave Ukraine. So, in my opinion, there is a lack of attention to medical workers, to medical workers' needs during the war. So we should care about them more. And despite the war, we should modernize our cancer services. And as one of our colleague from the National Health Service of Ukraine said, I don't know, was it her like saying, or she maybe quoted someone. She said that we did not choose a budget of simply survival. We choose a budget to grow and develop in Ukraine. And the ministry reallocated funding during the war, even to procuring 21 linear accelerators, and also dozens of CT and MRI scans, and also two cyclotrons this year were procured and are going to be installed in Ukraine, in Kyiv city and in Lviv city. So of course, you can ask me, or someone can tell, like, why do you spend so much money for expensive equipment, etc. And like, Ukraine is generating 18 times less GDP per capita compared to the United States, but still people, they demand dignity, safety, and modern treatment. That's quite philosophical, dilemma, because of course our country is low middle income country, but people in our country, they want to receive the same level of treatment, the same medicines, the same receive diagnostic, being diagnosed, and the same equipment as in developed countries, like European countries, the United States. The next slide is about our partnership, build partnerships during the war, despite the war. I of course apologize if I missed some organizations logos. I definitely missed some, but I try to depict. We usually try to show our main partners. We With these partners, we worked on providing patients with medical services, including cancer patients, including evacuations abroad, wounded soldiers and wounded civilians. And the European Union's temporary protection mechanism remains critical. Daria already mentioned that 4.37 million Ukrainians are protected across Europe, and with access to housing, healthcare, and social support. It is very important that our partners support not only the army but also our healthcare system. Thanks to your assistance, of course, hundreds of Ukrainian medical professionals have been able to improve their expertise and integrate into the international medical community. I have come to understand that during war, having reliable partners is just as important as having a strong army. Advance universal health coverage despite full-scale war. I just tried to pick some legislation approved by the Ministry of Health during the war. The ministry approved legislation for adopted first and foremost, adopted the National Cancer Control Strategy to 2030, in August 2024. It sets national goals for prevention, screening, early diagnosis, treatment, rehabilitation, palliative care. As Daria already mentioned, we are lacking resources, human resources and financial resources to implement that strategy fully. But the ministry, of course, approved legislation for starting early diagnosis programs for breast, cervical, and colorectal cancers. Also, government launched managed entry agreements for HPV vaccine and innovative oncology drugs. It means these steps will help prevent, cervical cancer and reduce the financial burden of treatment for patients. There is still a lot to do, of course, and together with the colleagues from the Ministry of Health, we are working on improving electronic medical systems to establish proper data flows, clinical documentation standards, and real-time monitoring of cancer care. Because maybe you noticed from Daria's presentation that there is a lack of data, a huge lack of data about cancer in Ukraine. So we are trying to improve that right now, and fortunately, like 99% of healthcare facilities in Ukraine today are connected to electronic healthcare system, like to centralized governmental database, and we are able to collect all information in one place from all hospitals across Ukraine. That's a great opportunity. We just have to set new technical requirements, for e-health system to implement these requirements. And sorry, I don't follow my time. But to summarize my presentation, in my view, resilience and development must be Ukraine's main strategy, and key advantage for Ukraine during the war has been the support of our international partners, of course, including microfinancial assistance, because without financial stability, like, it is difficult to sustain services, not to mention continue some transformations, some reforms. And another critical factor is the flexibility of our healthcare system. I try to depict you our single-payer healthcare system because this single-payer model has enabled us to respond quickly to emerge challenges and adjust our priorities and relocate resources where they are needed most. And as famous British economist and politician William Beveridge mentioned in his report in 1942 in the UK, the purpose of victory is to live into a better world, and each individual citizen is more likely to concentrate upon his work effort if he feels that his government will be ready in time with plans for that better world. So we have to make our best for those who sacrifice their lives for Ukraine. Thank you.